Hey, this is Girl Talk with Lisa Hale, the Silver Stylist, and this is episode 2, and we're talking with my dear friend, Elizabeth Whitaker from Atlanta Face and Body. So today the topic is fillers. So we have so many questions, and I had so many people that wrote and asked me questions. So first and foremost, explain what a filler is and how they're used.
Well, a filler is a synthetically produced injectable, and they're made out of different substances depending on the particular filler. The most common ones that are used are hyaluronic acid, which is a naturally occurring substance in our skin. There are also ones that are made out of something called calcium hydroxyapatite, which has characteristics that are similar to bone. And all the fillers are designed to go into the dermis or deeper in the skin. Some are designed to go down to the level of the bone in order to lift. So different fillers have different properties that make them suitable for certain areas and certain types of injections.
Okay, so explain, like if someone comes in and they're interested in fillers, I know that, where they can be placed and, what are the do's and don'ts? Because I know people come in and ask a lot of questions about, can I get it here? Can I get it here? How long will it last? That's another great question that I get,
And that is a very great question. The fillers have actually more and more come on the market that potentially have longer longevity, and they're designed in a certain way and cross-linked in a certain way to make them last longer, but they're not suitable for all areas. So a lot of it depends, and part of what I do in a consult is figuring out what you want and what you're looking for, and then what filler is appropriate to that area. So for instance, some of the fillers we use for their lifting properties that go deeper can last upwards of 18 to 24 months. There are other fillers that we use more superficially for finer lines and wrinkles. They're going to last probably closer to maybe about 9 to 12 months. So a lot of it has to do with the properties of the filler itself, how long it lasts, where it's supposed to go. And that's what's important, not just to, I say, you don't want to group on your face and just get one filler everywhere.
Right.
You really want to have certain fillers in certain areas. And when my patients come in, I look at my job is to kind of guide them as to what's the right program for them.
Right. Okay. Well, I know when I came in, my biggest, my areas were around my eyes. And of course, when we get to that age and everything kind of starts to fall with the aging process. So my issues were along my cheeks. And so explain what are those that are used in the eye area to kind of pull out the, I guess it's you lay against your orbital bone?
That's the orbital bone, exactly. Right. So there you want a filler that's going to have properties of being thinner and more liquid and not going to show because that eyelid skin is very thin. Right. So I use a filler that has more of those properties that will lay down on the orbital bone and not show through. Whereas the fillers that we used in your cheek were really designed more for lifting. And so the longevity there was more significant than the longevity for under the eye, but they also have those different properties that makes them most appropriate for those areas. So in your case, we used FILLER in the cheeks because that gives a great lift. Right. And then we used a little product called Bellaterra kind of underneath the eyes, which kind of gives a nice smooth contour.
And I know a lot of people, as we age, we get darker, and as that sinks back in. So that's one of the things that I noticed is that it lifted, almost lightened up my eye area. And so explain how that is. That because of the fact that there's the blood vessel, and that's what you see as you age, the skin gets thinner there, and so you lift that up, or what causes that to lighten up?
Well, what happens is we lose fatty volume, and we lose it around this orbital rim tear trough area, as it's called, which creates that separation between the eye and the cheek. So when we restore some of that volume that we've lost, it helps to fill in that area and make it less of a shadow and a little more light reflective. So it's really about the play of light and shadows on the face. Okay,
excellent. Another question is hydration. So explain, does filler give you hydration, or is that when you inject, does it cause hydration, or is it just that the skin appears to be hydrated more? What is it, or does it actually do that?
Well, the fillers do attract water, and certain ones attract water more than others. So that can be a good quality or not a good quality, depending on where you inject it. But it's going to be more, we also use fillers sometimes more superficially. We do a little procedure called baby tox, where We use a little neurotoxin mixed with filler in the skin directly to try to hydrate the skin and also to help to shrink the pore size. So you can use those hydration qualities superficially, but it's more that the skin looks that way, I think.
Because it has that plumper.
Because it looks plumper and it looks more light reflective.
Excellent. I hadn't even thought about that. But a lot of people ask. So what's the, okay, so you talked about the two different types of fillers. One is the one that has the one that has the bone. You said it has.
Yeah, hyaluronic acid is probably the most widely used filler. The other one we talked about, this calcium hydroxyapatite, is a filler called Radiesse. So that can be great when you really want a lot of projection. So if someone has a retruded chin or a jawline, that can be a great off-label use for that. And we use a lot of fillers, what's called off-label, which means fillers get approved for certain areas, but they can be used in other areas of the face too. So that's an important thing to be aware of as well, is that your physician may be using it for an area that they think it really has good properties.
Oh, okay, so I didn't even know anything about the off property and on property. I'm trying to think of, this is off script, but anything else as far as how long, longevity, does longevity have anything to do with your metabolism?
Yeah, that's a great question. And there are patients who can tend to be high metabolizers. I do have some people who come in and feel like the filler just goes away really quickly. And I think that could be potentially a combination of things. Sometimes that's under correction because, fillers are not inexpensive. So sometimes someone will come in and I'll recommend that really for optimum correction, we probably need to do this amount of filler, and maybe that's not in their budget right now. Right. And so we do a lesser volume of filler, and that may appear to go away quicker because we really haven't corrected it to optimum correction. And that's really where the studies are done on the longevity, is to an optimum correction. But the other possibility is that they could be a fast metabolizer. They're very athletic. Sometimes we will see people who just seem to have difficulty retaining filler, but fortunately that's a pretty small group.
Okay, yeah, because I know I had done some reading on that, and people had talked about that. Is there an age cutoff for getting filler?
That's a great question. And I think filler is one of those products that's accessible to just a wide spectrum of ages. Because I'll see younger people sometimes who just naturally have genetically little eye bags that they want to camouflage, even though they're in their 20s. And so we're not really dealing with an aging problem. We're dealing with more of their genetics, or they naturally don't have a lot of cheeks, so they're very flat here. And we want to do really using the filler less for anti-aging and more for facial contouring. Having a strong jawline is very popular now. So a lot of people want that more contouring of their face. But we continue to use it for volume loss that we do get with aging as well. And that really can continue as we get older. But as we're older, you may need more filler volume because you've lost more volume. Right. But there's not an age cutoff per se.
Right. And these are all things that are non-surgical that you can do.
Correct.
Until, you come to a place to where you feel like this is not what I want to do anymore, or I want to continue, or that you're ready to move on to the next step, which is something that is surgical. So
exactly. And we have options, and that happens very often, that people will have used filler for a period of time, and then we may talk about a fat transfer or something that's going to have longer lasting filling aspects. But I think the longevity issue is a great question, because some of the fillers are going to last longer than others. Sometimes I'll have people, and they want a particular filler because it lasts very long, but it may not be appropriate to that area. And we have to then talk about why that's not the best filler for that location. And that's why it's important to have someone to help guide you to selecting the right fillers for your concerns.
Oh yeah, it's very important, because I've seen a lot of really horror stories on people that have gotten fillers that were that really was a botched job, and it's scary. Okay, so let's talk about, so we talked about cheeks. So what filler is used? Because I know a lot of people, lips are big now. And so tell me what's going on with lips, and what are the fillers? I know there's new ones coming out. Because we had talked last time I was in about a particular brand. But anyway, a line that was out. So tell me what you use on the lips and why.
I use a variety of filler, and it really depends on what the person is looking for. So there are several fillers that have been approved specifically for the lips. One of them that we had talked about was Restylane Kiss. I use a lot of Juvederm Fabella. which I think makes a beautiful, more subtle lip. Versa recently has gotten approval for the lip, and that's a great product as well. And sometimes I'll use other products that are more of an off-label use for the lips if I really want to get a lot of volume, if someone really wants a big volume change. So you can do a lip that's very subtle and where you're almost giving it more the look of a little lip liner, just a little plushness to the lip.
Right.
Or you can do a lip where you're giving someone a big boost in volume. So, again, it's not one filler all the time, every person. It's really customizing it to what that person wants. And I think lips probably are an area that I customize the most because people very often have a specific idea in mind. They'll bring pictures, which I find very helpful because sometimes when somebody says they want a lot of volume, the pictures they show me may be more subtle or maybe
more voluminous,
more significant than I'm just necessarily thinking by the words. So that's often a very helpful interaction to give an idea of what they have in their mind.
Yeah, preconceived notion of
Exactly.
what they're looking for.
Exactly.
Well, and I know for you are very conservative, and I mean, you're very honest. Because I know asking questions, we've talked about stuff.
Mm-hmm.
No, I don't think that that's going to be right. And I know when Jessica came in and we talked about fillers with
Mm-hmm.
her, she wanted a little bit more lip, and you're like, oh, let's not do that. So I appreciate that because I know a lot of times people will go in and a doctor will do what they ask, and then they're really sorry that they did that. So I appreciate your friendship and your honesty and your
very much.
And what you do because you've done it long enough to where yes, that's what I guess I look at it. Same profession when you want someone that's going to be truthful and honest
Mm-hmm.
with you, not just do what you say and then be sorry that they did that later.
And part of it too, particularly with lips, is that, when we initially inject, you get a fair amount of swelling. So for people who are looking for a subtle lip, there can be a little bit of that little filler shock. I term it right when you look at it, but then it's going to go down in a couple of days. So what I tell people typically is that, if you look at it and you're like, oh, she did a little too much, that in a day or two, you're probably going to be wishing that it looked fuller again. And similarly, if someone wants a lot of volume, I'd rather them come back in a couple of weeks, and I check all my filler patients back in a couple of weeks so that we can, make sure everything's settled the way we want it to. Make sure we don't need to add because you really start to like that look and you want to do a little more volume. And that's particularly true of the lip. I'd rather, it's much easier to add. You can't really effectively subtract. I mean, we can dissolve filler, but that's obviously something we want to avoid doing most of the time.
Right.
So I'd much rather give somebody a full lip, let them live with it a little bit for a couple of weeks and really decide whether they're comfortable with that or they want to go bigger. And then we can always add.
Yes, and that's great. I mean, and that's probably the best way. I mean, since I've been coming, that I think is the best way. Just because if I knew I wanted a little bit more here and there, that was when we came out. When I came back for my 2-week checkup, we could always do that. Speaking of dissolving, so it is because people ask how permanent. Like if I get filler done and I'm not happy with it, or I don't like the way it looks, or I'm concerned, whatever the reasons. What is it that you use to dissolve it, and what happens? And with the skin, is it permanent? Does it cause any issues, or how does that work?
Well, the filler that we use the majority of the time, which is your hyaluronic acids, are dissolvable because there's an enzyme that will dissolve that we can inject. So if someone has, most of the time, fortunately, we're not using it to dissolve the filler, but I do occasionally have people come in. They've had filler elsewhere. They don't really like it. We want to dissolve it and start over.
Right.
Or if anyone had any complications, gets a little, lump or bump, then you always have the option of potentially dissolving a little bit of that filler. And once it's dissolved, it's gone. So you can't always control how much of it dissolves. So, I always talk through that as to whether we're going to try to dissolve in a localized location, or we're just going to dissolve and start with kind of a blank canvas.
No, and I understand that too, because I think it's good that you're able to do that, because if someone does come in and has had someone else's work and is not happy with it, they're not stuck to where they have to, they have to go on with life until that dissolves away, and they have the opportunity to come into you and you can start anew. So that's, great. And that's what the consultations are about too. Talk a little bit about the consultations when someone comes. I know that you all have the 3D in that, but you talk about and what's explained I know there's literature that you send home, because I did a lot of reading on that with all the pamphlets that I took home when I first came, 3 years ago. And that was great to have that literature and read that. And then if I had any questions, I know that, there's anybody that's capable here to answer them, but it's all, you're very good about answering and explaining those questions too. So when someone first comes and they're interested in this, what would be the procedure?
Well, I think a lot of times sometimes they have an idea what they want. They're more direct. So for instance, if someone wants lip volume, that's usually a little more straightforward, because then it's a matter of talking to them, getting an idea of what degree of volume they want, what kind of lip look they want. Do they want to keep more of the 1/3 to 2/3 proportion, or do they want to go more 50-50, which is a little more popular, particularly with the younger generation having a little fuller upper lip. And then it's a matter of figuring out which filler is going to best get them to what they're interested in. Other times people come in and they don't really have a specific idea. They just know they're looking tired, and they're aware of the hollowness and some of the volume loss. And it's then a matter of talking about how, for me, I think the cheeks are a fundamental part of it, because we start to lose volume here, and that leads to the folds here and contributes to the hollowing here. So we want to get that foundational support back to get more of that lift to the cheek area. Then we can fill in other areas like the hollows under the eyes, the folds, marionette lines here, and even the temples, areas that people may be starting to show those signs of age.
Yeah, and just I know for me, my big issues were
the lip lines. Absolutely.
The lip lines, and they just come over time, using a straw. I mean, it's just another thing that comes with age. That was a big issue with me. And also because I liked wearing dark lipstick. So your lipsticks tend to feather, unless you're wearing a really, really dry lipstick, they tend to feather up in those lines. That was a big thing I wanted resolved, because I wanted to be able to wear those bright, dark colors in the fall. In the winter, that we love to wear the reds and the darker burgundy colors that I was unable to wear, because after I wore them for a little while, it's like it was all over my face. Yeah.
And they're great fillers for those fine lines.
Oh, absolutely.
That can, not only plump up the lip, but go up into the vertical line itself to try to blunt the appearance of the line. So, that's a great place for the different fillers for the lips as well.
Yes. So, I'm trying to think, is there anything else?
We could ask about, is there anything new on the horizon? And I can talk about some of the biostimulatory
What
stuff.
are we at?
We're at 17 minutes.
Okay. I'm sure there's stuff we can add. Okay. So, we're going to ask if there's anything on the new, anything
that's new. Yeah.
Yeah. Okay. So, is there anything new that's on the horizon that's coming out that's exciting to you that you want to talk about?
Well, we're continuing to see more and more fillers come onto the market. So there are going to be more and more choices out there over time. Also the same with the neurotoxins. Everyone's familiar with Botox, but there are more and more that have come out. Another thing that's very exciting to me is using fillers in different ways. For instance, we talked a little bit about calcium hydroxyapatite, or Radiesse. And that has somewhat unique properties in that not only is it a filler, but it is a biostimulant. So it helps to stimulate collagen. So one of the new off-label things that we've been doing that I think is very exciting is using it in a hyperdilute fashion. So thinning it out so that you're not using it as a filler anymore, but you're using it to stimulate collagen. So it can help the appearance of the skin and the décolletage and the neck, can help with the arms, the crepey knees, the buttock area, any area that someone needs to improve collagen and get a smoothing effect to the skin. So there are all kinds of different uses and things like that come along that are very exciting.
That is exciting, because our episode 1 was all about collagen.
Collagen, exactly.
Exactly.
And this is another way to stimulate collagen.
Right. That's very exciting. Very exciting. So that'll be it on our episode today, which is episode 2 on fillers. But come back, show up. We're going to continue these girl talks. And if you have any questions, I'll have to talk to Dr. Elizabeth what we're going to talk about next, but stay tuned. Check out Girl Talk on YouTube, on my YouTube channel, and then we're going to have, that'll be the full version, and then we'll end up having a short segment that we'll put up on IGTV at the Silver Stylist. And again, thank you, Dr. Elizabeth.
I had a great time. Thank you so much for having me.
Thank you. Bye, guys.